I'm curious if you can name 3 habits that you did along your training and faculty career that you are grateful for that made you as knowledgeable and thoughtful of a clinician as you are. What would those 3 habits be?
Yeah, so I think the number one thing was that I never assumed I knew anything. And so a lot of medicine is my attending told me this and I'm going to use it. And then there's a role for that. But I was always the person that had to go look that up afterwards. I had to see prove it to myself that what I was being told was accurate. And I think I was very, very scared, and I'm still scared when I treat patients that I'm not doing things properly. So I'm constantly looking things up. The other thing that I'm very grateful that I did was I found, in this case, a cardiologist that I really trust, I really like. I think he's a great teacher. And I approached him and said, "Hey, can you teach me?" And I think that's hard for, especially once you're an attending, to think about doing that. I think it's easy as a trainee when you're like your whole life is about being taught and learning and things. But we all know there's
Mhm.
nothing magic about getting your attending badge, getting your
Yeah.
long white coat, whatever you want to call it, and saying, "Hey, you don't know everything." And so having that ability to say, "Look, can you teach me stuff that I don't know?" And however you do that in whatever capacity, I think that was extraordinarily helpful for me. And then 3 was really approaching patient care with, I need to be able to look you in the eye and tell you that I'm doing everything I can for you. And in order to do that, I had to learn more myself, and I'm still doing that now. I mean, I clearly don't know everything. I will never know everything, but constantly looking things up, constantly learning, but also going that extra step. And, we kind of talked about in one of these cases, hey, did I really need the bladder pressure to treat that patient? No, I didn't. But I think the more you go that extra step and do those extra diagnostics that help you treat that next patient that comes in, that's been really helpful for me. So I'll give you an example, and you can cut this or not. I had a patient that came to me for a third opinion for a renal tubular acidosis, and she was being appropriately treated by whichever nephrologist was seeing her. But she had been Googling stuff, and she asked me, she's like, "What type of RTA do I have?" And I said, "Look, I don't know." And, people had done the appropriate workup, they had done the basic stuff to figure out etiology. And when it comes down to it, they were being treated appropriately. But she said, "No, I need to know what type of RTA I have." And so I said, "Okay." And so we set up a protocol, which had never been done here before, where we got her into the infusion clinic, where, excuse me, infusing sodium bicarbonate. We're measuring bicarb in the urine. We're measuring, we're sending urine through blood gas analyzers and doing all this stuff to try to figure out what it was. And did it actually matter? No, but we were able to, again, tell her, "Look, we've done everything we can to try to figure this out." And it taught me how to approach these things. I didn't know what the diagnostic criteria was for a lot of these things.
Yeah.
And you use that experiential learning when you
Go
see
for it.
patients later.
Absolutely. I love that. I asked you for 3 habits and you gave me, like, mindset.
It was not the right answer for
Oh,
the
no.
question you asked.
I loved it. I loved it. So much goes to mindset. But if you had to name some habits, like, in terms of, like, what did the looking up stuff look like? Like, was it you just staying late until 8 PM, 10 PM in the hospital when you're a resident or a fellow? And, was it waking up early, like,
Yeah.
what did that look like?
Yeah. So my habit was, especially as a fellow, that I told myself I was gonna read one paper every day. And that's it, right? You can read a paper in 5 to 10 minutes if you want to, right? But so my thing was, I'm gonna get in the habit. I'm gonna find time during the day. Maybe it's at lunch, maybe it's at home, maybe it's I have, hey, time between patients waiting for the next consult. There's always stuff we can read about a patient we're seeing. So I said, I'm going to read one paper every day. And I wish that habit continued to now, but with more responsibilities comes less opportunities to do that. And
Yeah.
so I wish I'd been able to do that. But certainly as a trainee, particularly as a fellow,
Yeah.
1 paper a day was my habit.
2 follow-up questions is, how did you hold yourself accountable to that? And then also ask the second one afterwards.
Yeah. So I would have, and this is God's honest truth, I would have an alarm on my phone that would go off at 8 p.m. every night. And it would basically signify, hey, have you done your reading? Right? It would be an alert that said, have you done your reading? And if I hadn't, I had to remind myself that, hey, I have to read something before I go to bed tonight.
I've done those alarms before, and then they start, I start
You
ignoring
ignore
them.
them.
Say it again? Yeah,
And then you start ignoring them.
exactly,
Yeah.
but you held yourself to it. But maybe because
Because
you saw the benefit.
well, maybe, but I think it's more because I'm just a very nervous and deathly afraid person at baseline where
Aren't we all?
I don't like not knowing stuff,
Yeah, absolutely.
and that was enough motivation intrinsically for me. And part of that is I work with really, really talented, smart people. And part of it is we're all been competitive, growing up. Part of the reason we're where we are is I think a lot of us are competitive at baseline, and you don't want to be that person that is falling behind, right? And
Oh,
so
totally.
those are my internal motivations to keep doing.
Yeah, we're so driven by not being behind. And so I
Yeah.
don't know if it's like more it's more exponential in our field or not. My follow-up question was, this was a beautiful time in your fellowship period. Was this habit possible when you were in residency? And you kind of all talked about the attending part of it.
Yeah, I think residency, yes. And I wish I had been better about it in residency. I certainly had co-residents that were really good about this, and you could actually see that and
Yeah.
how they performed on the wards and in the ICU and all this stuff. And hindsight's 2020. I wish I had been better about it in residency. As an attending, I think it's in my life, it's harder right now. There's work responsibilities, there's non-work responsibilities, there's family, there's all
Yeah.
these different holes at your time. But I look things up differently. I mean, to be honest, I use Twitter to help with my medical engagement, right? I love seeing how people post relevant articles for me and
Right.
post different learning points. And so that to me is I'm learning something that day. It doesn't have to be I'm sitting down with a journal article, but I'm trying to learn something that day.
Definitely.
And it's come in different forms, but I'm hoping that it's still effective.
Yeah. Well, I feel like you built such a strong foundation, and we're social beings. And so
Yeah.
maybe that platform allows for that a little bit. So thank you. Thanks for answering my like left field question. I
Yeah.
was like
Yeah.
really,
Yeah.
I appreciate you and I appreciate knowledge. And I always love understanding people.
And I think the
And
other thing that's helpful is that's helped me is just taking chances and not being afraid to take chances. And an example of that is, I mean, for you and people that are attendings know that once you start in academic medicine, it's not a lack of opportunity that's out there. You start getting bombarded with all these
yeah,
different opportunities, and being vulnerable and being able to take stuff on that you may not be totally comfortable with, as long as it's going to be a good learning opportunity for you. So whether that's writing an article that you know nothing about, right? And going through the process of doing the lit review, learning about that material. I'll tell you, one of the big things for me was I got this text message from Joel Toff who said, "Hey, do you want to come on and join this project Freely Filtered and start editing the podcast?" I had no idea how to edit anything. I had never edited. I had no experience with audio editing or anything. And I said yes, and essentially had to go on and try to teach myself how to do this. And that has benefited my career significantly. Kind of having that experience now has been super beneficial. And I didn't know anything at that point.
was awesome. I love that story. Well, I'm so grateful for getting to know you more than just like a face on my Twitter feed.